First, just a brief historical perspective on our drug court. A Dependency Drug Court was implemented in 2000 as part of the Juvenile Dependency Court. And drug court's designed to serve family maintenance cases. That's cases where the children are placed with their mother. Specifically, it's for mothers and their newborns for our drug court. We've now expanded to include children up to age 3 and siblings as well. Our goal, of course, is to have children placed with their mothers in a treatment setting as soon as possible. Typically, a family is offered 12 months of intensive services and case management, and that program has both an inpatient and outpatient component, which can vary widely for each client. A family who's eligible will be willing to enter treatment immediately, and if drug court services are offered, the case is primarily managed by the Children and Family Services social worker. That's also known as the drug court social worker. The drug court social worker would present the case to the drug court team for recommendations, and a coordinated case plan would be developed. The drug court social worker monitors participation in services and reports to the drug court team. The drug court social worker is also responsible for the 6-month status review and any interim reports to the court.
A strong rapport with the patient or the client, because without respect and dignity for the client and unconditional positive regard, it just doesn't work. And the client has so much more success when she has positive support from the entire team. The public health nurse brings to the team, she helps the client with all her health needs. So she starts out doing a head-to-toe assessment, and they talk about the client's health concerns, any medications she or her child may be taking. The public health nurse also does a lot of screening tools. We use the Denver developmental screening tool. We use ages and stages to detect developmental delays.
The behavioral health clinician, along with the Dependency Drug Court team, will continually assess the client for different levels of care and the appropriateness of those levels of care for that individual client. One important feature of the Dependency Drug Court program is that it does provide a continuum of care for the clients. This is represented in current practice as a wellness and recovery model. Overall goals of treatment are that the clients have gained and sustained their sobriety, that they have demonstrated competent parenting, that they have accessed positive social supports in the community, and have gained the emotional stamina and stability to effectively cope with daily life.
Miracles for Moms has 2 settings, which New Start and Miracles for Moms are intensive outpatient treatment. And they provide gender-responsive treatment is provided to all Dependency Drug Court participants, which address women-specific issues, emotional, family, parenting, social needs, as well as trauma effects. Treatment is individualized, which is nice. We have that availability to make it fit to the mom. And what's nice, what we're seeing a lot of times is when that case is closed and the child is returned to the mom's custody, women decide to stay in treatment. They don't just leave at that point. So the longer the treatment, the better for mom, the whole family. Women stay in aftercare.
California work opportunity and responsibility to kids, it is really most commonly known as welfare. So once a client enters a treatment center, one of the first things we want to do is to have her apply for cash aid, food stamps, and Medi-Cal. And about 50% or so of our clients are receiving CalWORKs. So once her CalWORKs case is approved, I'll be meeting with the client to set up an individualized plan so that I can begin to start providing supportive services to that client. So if she has doctor appointments to go to or NA meetings to attend to, I can provide her with bus passes, and I can also provide her with paid child care services.
Our drug court program offers the most intensive support we have available to substance abusing mothers and their drug-exposed infants. I'm very proud of our program. Our success rate is high. We really do help moms keep their babies and become sober and better parents in the process. Thank you for your time and help, and we're counting on you to help us help these families.